Is that okay?
Yep.
Slide.
Yes, okay. Welcome, everybody. I'd like to call the Health and Human Services Committee meeting. I'd like to call it to order. And if we could start with a motion to approve the April 11th minutes.
Motion, Lydia.
Second, Christina.
Okay, thank you very much. You can see on the agenda tonight, we have 10 resolutions, 2 health department, 3 Department of Social Services, 4 from mental health, and 1 from the Office for the Aging. And in addition, there's 1 ledge resolution, and it's ledge 2, and that's really, when I go over that, will be really for information only, because this will be a resolution coming to the full legislative meeting on the 24th. So if we can, maybe we could, because Brenda only has the 1 resolution, maybe we could start with HH9, which we have been talking about for quite some time, authorizing the renewal of a lease agreement between PFI Housing Company of Auburn for a portion of the premises at 149 Genesee Street at the Royal Center. This will be a 2-year lease, $12,000 a year, and it will finally get the Office for the Aging all in 1 location for a temporary period of time. And as Brenda said before, she has the money in her current budget to cover the lease and the rent. And, you know, I think PFI and the Royal Center has done a really good job at, you know, making this available on a very reasonable rate. So if we could get a motion, somebody
Yeah.
move it.
Second, Lydia.
Okay.
We did. I thought we just moved it.
I just got the.
You're right.
Okay.
Yeah.
We'll vote for the minutes?
Yep.
Yep, all in favor?
Aye.
All right, great, thank you. Okay, do we have a motion for HH9 in second? Okay. Is there any other questions for Brenda? Yep.
Brenda, I realize that we have the money in the budget for this, and thank you very much for being mindful of that. Is this increasing cost so that we're gonna end up perhaps looking later that we really need some more help financially, or do we feel confident that it won't lead to that?
We have the funding for 2024. The thought is that at that point, perhaps the county will have a solution to bring us into county property in our entirety again.
But until that point, it's still no problem.
Until
Status quo.
2024, for sure.
Perfect, thank you. Yep.
Do you have an amount of square footage that you last one?
Yeah, it's 1,200 math, 3,600.
Oh, this new lease was 1,200?
The one lease was 14
Oh.
and downstairs is 18.
30 square. Okay, thank you.
Plus we use the kitchen over there and some storage space that's also not part of this.
Well, I'm happy about the kitchen. I just want square footage as opposed to $150.
It's double what we have.
That's great.
And you think you'll be able to get the IT stuff done or you'll move in maybe June?
June.
Okay.
No, it's a little bit bigger undertaking for IT to expand from just the 1 level to 2 levels and twice as many staff. So that's a process, and getting the dividers that we need will take a little time. Working on in July, maybe. That's the latest. It's kind of a-
Any other questions? You want to get anything from your report?
I think you have to take a.
Oh, that's not.
That's okay. No problem.
All in favor?
Aye.
Any opposed?
So for my report, okay, all right, we are, as I mentioned, in here, going to bring a proclamation to the May 4th meeting and inviting 3 seniors from the community to be recognized. And I'd like the appropriate legislators know, because we very much appreciate your role in honoring these seniors who have done so much for our community. And then they will be invited to our volunteer picnic, which will be not only the seniors that are recognized, but also all of our Meals on Wheels volunteers, which at this point numbers well over 80 people. And we're also all invited to that. So we did not yet get an invitation, let me know if we all did get an invitation. If you are planning on coming or you think you're coming, at least you could RSVP. That would help us figure out plans and get our food order in. Last year was the first year we did this out at the Upesco Pavilion, and it was just beautiful and worked out really well. So hope to see you.
If we want to go on to HH1 and 2, two health department resolutions. I did pass out for HH1 the fiscal impact that the finance staff of yours did to everybody. So, yes.
So, great, thank you. HH1, it's a request to, as similar to last month, we had this past month a retirement of a staff member who went at the office for a number of years. This really created an opportunity that we didn't anticipate for a few months because of the timing, to again take one more of the jobs and bring it up to the standardization that the federal WIC program is encouraging with all WIC programs to have similar jobs, job titles. WIC in Cayuga County, same as WIC in Pennsylvania, same, Texas. But it also, if we're given the opportunity to create this position as support specialist, allows those of you who already were able to have the tour, one of our front end staff members, to take on a little bit more work as outreach coordinator, as well as do a little bit of the weights and measures that the WIC assistant would not typically perform. So we're looking to vacate a WIC assistant job and create the WIC program support specialist position. It is all covered through the funding we get through the WIC grant.
Motion for HH1.
Blackham, second.
Okay. Any questions?
What is the grade of the assistant position that's being taken away?
So that's a 4, and we're looking to make this a 10. And what will be nice is there are 2 front end people, so we'll maintain 1 WIC assistant and then 1 program support specialist if we can. So it's an opportunity for upward mobility. So, if that ever vacates, which is
And that's kind of what this sheet's supposed to illustrate.
That will be budgeted,
Okay. Thank you.
and that will be budgeted, and you don't have to worry about impacting your budget negatively in any way, even if something happens to the reimbursement aspect of it.
well, if something happens to the reimbursement, the whole program is going to be in trouble, right? So it won't just be that position. So correct, short answer, correct. It is fully, it will fit into this year's budget because we have vacancies, and it is budgeted in our ongoing budgets for this role. And what we try to do, there's actually just came out the RFA, didn't just today. There had been a problem at the state level with rolling out the new RFA, so they had retracted it. But we had already done some work on it, so we're budgeting for our desired positions at their cost base to try, a part of the 5-year, so that we can make sure that we cover the salaries and fringe benefits.
It's a great thing. Thank you.
Favor? Okay. Great.
Thanks. Second resolution is our request to accept our rabies funding. They sent it to us as a 3-year allotment, so much per year. It's about 26 some a year. And this we use to help fund rabies treatments, and also to fund the mandatory, we're required as a local health department to have rabies vaccination clinics 3 times a year for dogs, cats, and parrots at no charge to the public. So we pay the SPCA helps perform this for us. And we'll pay for the materials and the vaccine. And we- so we have budget.
I'll move it.
Jeez.
Accepting 3 years worth of grant funding, all in favor?
So there's been a little bit of information on there. It's a real nice change for me to get to go. It's just been so long, right, for everybody. I'd gone to a conference a couple weeks ago. It was sponsored by my state show and the State Public Health Association. And I'm an introvert, and I don't especially like hobnobbing with people, but it was really great to do that because, you know, it's people who are in the same profession and a lot of great topics. Big focus, now the Alzheimer's Association was one of the sponsors of the conference, but it was really great information about Alzheimer's as a public health crisis and what's going to be happening, particularly in our communities over the next 3 years in the incredible increasing numbers of people who will likely be diagnosed. Climate change discussion, a lot of discussion, and we had a little bit of talk about this at our Board of Health, and we talked about more as comes along is the copper and lead rules that are forthcoming. That's a big thing. It's going to be municipalities and community water systems and public water systems. So we have to take a look to see what your pipes are made of. And if you don't know what they're made of, then you're going to have to make some reports and do some testing on a routine basis because they're going to be looking at lead poisoning prevention. And this is one manner in which it's being addressed because some of the lead pipes can corrode and cause some increased lead into the water. Some of our places, like the city of Auburn, has already had a curve on this, and they've been going after some funding to help replace some of their lead pipes. So it's going to really, it's going to be tough to implement. And in 2024, I believe it's going to need to be implemented. So you'll be hearing a little bit more about that over the next little while. Clinics are still going on. We had, you probably saw in the newspaper and Citizen, one of our injury prevention programs is through our pedestrian and sport safety grant. There's a bike to school. They do in the fall, a walk to school event. And in the spring, we do a bike to school. It's mostly for the bike to school. It tends to be the city schools and Moravia that participate because a lot of the other schools are more rural and aren't really safe for children to ride their bicycles to school. But it's a great event and there's helmet safety. The event coming up this weekend or next weekend about recycling sports equipment. There's an article in the paper. I'm not doing it justice by not getting the name right, but Joe Mushak, who coordinates this grant, is part of this program. And
Is it sports prom?
that's it, with Sports for All. And they're calling this this particular event a catchy name, a catchy name. So if you see the newspapers in yesterday or today, they're gonna, along with sports equipment, they're going to have bike helmet fittings, bike rodeo for bicycle safety, and it's a great way to engage children who are going there to maybe get a tennis racket, but then, hey, I don't know, I have a helmet, it's fitting me the way it's supposed to, maybe I'll wear it that way. That's a good thing. And then just a couple more things. Our IT department, as David shared and Tom shared, is responding to an audit. The health department is part of that audit. It's not a focused one, so it's still in process. There'll be more to come. Tom did indicate that the auditors have found their response very favorable, so we'll hear more. Working on a statistical report. So the last couple of years, we didn't do. Yeah, we were occupied. But we're working on pulling out some of the statistics for 2020 and 2021 combined one. So Elaine, I know you're familiar with this because you've seen it and started this together. But I think this will be very interesting. It goes over a number of our programs. We hope to have it prepared by June. We had trouble with our environmental system. We weren't able to get some of the environmental data and some of our communicable disease data with through our state systems. And they weren't being queried easily. So working on that, so hope that in June, we will show you, it quantifies, right? It's not gonna tell you the whole story, but it's gonna give you a sense over the last couple of years, in addition to our COVID response, all the other work that we continue to perform that is required. We find it interesting. And then one of the things that Eileen and I spoke briefly about, we spoke a little bit about it, David may remember at our Board of Health meeting, the rates for preschool special education providers. We're having some discussion tomorrow of, and our staff queried 11 of the counties around us, including us in the 11. We have a very low reimbursement rate for our preschool providers. That would be our special education teachers, occupational therapists, speech therapists, physical therapists, who work with children who have developmental delays. Is that the answer to everything, the rate as far as engaging people? Maybe not. But we are significantly lower than our surrounding counties, so we'll put some of that data together. We'd like to be able to raise their rates and hope that it will engage and retain them and maybe make it a little bit more palatable to serve some of our rural areas where that's the hardest place, because you don't get as much bang for your time if you're a therapist and you have to drive from site to site because you serve children in their natural environments. So putting some thoughts together. I'll talk with you more about it next month and potentially have a resolution. July 1st is the beginning of the school year, and that's, you know, why this was coming. We've done a lot of talk, but we haven't taken a lot of action. I certainly don't want to rush this, but if it is something that's feasible, system-wise, starting it at the beginning of the school year, July 1 is the ideal if there's a rate change. Otherwise, it's very cumbersome to maintain a payment system at 2 different rates through that year. There'll be more to come. So yeah, I want to put that in your brains, and so you can be thinking about it and get some more information.
You know, in Christina's report, she mentioned that New York State will be investing, doubling its investment in childcare. Is that childcare investment cover preschool education, or just specifically?
No.
Yeah.
Childcare?
Has to be preschool education.
Subsidized care? I don't believe so.
I think universal pre-K is supposed to help with that. Certainly, we haven't followed that too closely. But right now, our number of our children who are engaged in preschool special education programs, some of them go to preschools like the Gabber Center. We have center-based care, and some of them maybe only need one therapy. Might have a therapist visit at their daycare or at home. Grabbing grandpas if that's where they're at. And it's all sorts of options.
The state sets the early intervention rates, so you don't have to worry about that. The state education sets the tuition rates for 3 to 5. This is the only subset where the county sets their own rates for these itinerant providers that go out into the community for the eligible kids. And you said that the rate hadn't changed since 17.
It was 2017 when it went up $1.
Yeah.
Right.
Right.
That was
That's all talked about
2014 and out of $1.
Yeah.
So we're looking to bring forward.
We're going to try to evaluate if you get funds within our own budget to be
That's
able
the first
to
step.
afford it. Right.
That's our conversation tomorrow, to see if there's anywhere within our existing budget that we could potentially cover what we would anticipate would be that change. We are able to increase.
Yeah, Kathleen, are we still get reimbursed for our vaccination in our clinics
We
through
are,
that state of emergency?
we are, you actually bring, so we're getting reimbursement within the for it. And the administration of it, correct. So the vaccine is no cost
Right.
to receive it. We have a number of grant funds to pay for the supplies. We're using grant funds to pay for some of the staff.
Mhm.
And then we are able to bill for the administration, and it is a greater reimbursement rate than any other vaccine that we provide. We get $40 administration, which that does cover. It covers some of the costs. we utilize Meta. We're actually, just getting an opportunity, we're just starting the implementation process of integrating Meta ourselves within the health department. So that's going to take a few months till we're up and running. It's an electronic medical record system and billing system. But this is also the system that we have partnered with the hospital to be able to bill for the last year and a half. So that was a really great partnership. Meta contributed at no cost for us, and the hospital helped us, and it was really a great community response to a need.
Thank you.
I think very easy resolutions tonight. Maybe we could group page 3, 4, and 5 together, and we could go through them, and then we could get a motion for all 3, and then we could ask questions.
HH3 is for accepting funding from the Administration for Community Living for APS, for Adult Protective Services funds. A few months ago, I was here and I talked about $19,000 we got as our allocation. We have 2 more allocations coming, a little bit over 16,000 and then a little bit over 28,000, which we will use in the same way to provide some direct services to Adult Protective Services clients. We're also, because we've gotten more money, we're going to actually look to upgrade some of our technology, provide our Adult Protective Services workers with upgraded equipment, laptops, and they can use out in the field. And I've also been talking with our IT department about some problems that we have within the department with Wi-Fi connection. And when folks are using their laptops, having good connection is important. So we're going to be exploring whether we can use the money to help enhance our Wi-Fi in some of the areas in the department as well. That's HH3. That's all federal funding. So we're county funds for that. HH4 is really the health human services examiner within the temporary assistance area due to a resignation. It's a budgeted position in the 2022 budget, and it's 62%, at least 62% state and federal. HH5 is for us to enter into a contract with LabCorp for genetic testing that we need to have completed for our child support services unit. We're going to determine genetic paternity. And the cost for that is also reimbursed 66% federal, 34% local. It's $45 for the first few months of the year, and then $55 going forward for the contract that will go from 2022 to 2026.
Could I get a motion for HH3, 4, and 5? Okay, any questions on those, any of those resolutions? Do I need a motion bundle? I said I was going to put them together. Yeah, okay. That's okay, no problem. Any questions on those?
I put some,
All in favor? Thank you. Any opposed?
so I had put some points to highlight some good things that are happening around some, opportunities for folks to receive assistance. If anyone has any questions about those, or needs information, just get in touch with me. There's a lot of information on our website and also on the state website about the heat cooling assistance program, and also about the child care subsidy that people are going to be able to get. A lot more people will be able to get assistance for child care costs than we have ever seen before. That's I think going to help a lot of families. I had put down at the bottom of my report that we had numbers for emergency housing at around 94. We are even lower right now. I checked as of last Friday, we were down to, I think, 83. So we're seeing the trend moving down. When the weather's here, we've had some, positive outcomes with folks finding permanent housing. Some folks that have sought treatment for needs that they have, and so they are no longer in emergency housing. So that's a move in the right direction for sure.
Hopefully it makes a huge difference too.
I think somewhat.
Yeah.
Yeah.
The fraudulent investigation you and the sheriff were looking at, he talked to me about it at length. How's that looking? Is it-
But we met together, he brought his detective lieutenant and I met with some of our staff from DSS were there, and we talked a little bit about some of the concerns with, you know, just some suspicion that there's some fraud going on with people using parks that aren't theirs and selling their parks for money. So we had some ideas and some strategies on how we can kind of target some of that, and we think that's happening, and put together a plan, and we're gonna see where it goes, but I think that it should have an impact for sure.
Great. I'm glad you're working with them.
Any other questions? Thanks.
Thank you.
This is Liz Burke, everyone. She's the Deputy Director of Mental Health. Lori is, I guess I don't know what she's.
Wow, she's only been the director
Yeah.
since January, I don't know.
So you have 4 resolutions tonight. You want to start with HH6?
Is that?
It's the authorization to fill a senior clerk position.
Okay, so, at mental health, we have, a core staff of 4 in our front office. And as if you've ever been there, you know, it's a really busy front office. And everybody basically has the same job responsibilities and they rotate. However, there are 3 to 4 different civil service job descriptions in that front office, and they're different grades. And so we just want to standardize it so they're all the same grade. So this is just asking for us to be able to reclassify and fill a senior clerk position. And it's a difference between a grade, grade 5 and grade 8 for a total of $1,442. And the money is in our budget.
You're going, okay, you're planning, all right, can we get a motion for that?
Want to go with it?
No, you can, so.
Okay, so you're gonna abolish the 1 position and replace it with the higher grade position.
For that position. So HH7.
Well, can you vote on that?
Oh, sorry.
All, anyone in favor? HH7? Yes, the HH7 is to authorize the Director of Community Services to accept a grant from the New York State Criminal Justice. It's a $30,000 grant to train and implement a school-based DBT program.
Right, so we've received this grant in the past. It's, as Lynn said, it's $30,000. Our plan to use those funds is to implement what's called the Universal DBT program in some of the rural schools. Moravia and Union Springs so far have expressed interest. So this is like a universal curriculum that's taught to all the children in the school. And it provides like emotional regulation skills, mindfulness skills. It's just like it's based on an evidence-based model.
Motion for that? Yes. Okay, no question. Okay, can we get a motion in a second? Okay, second?
Can I move?
You can.
Second.
Okay, all right, Lydia, you have a question on this?
I probably should know what DBT stands for, but I don't.
Yes, that question. It stands for dialectical behavior therapy, and it's a therapy that's been around for a very, very long time. It was initially used with some pretty seriously mentally ill people, but over the years, it's really the skills that are incorporated into the model have really been tested and seem to be very effective across a wide range of mental health problems, from very severe problems to just kind of like minor problems of anxiety and depression. So it's those skills that will be incorporated. It's not therapy that we're going to be providing in the schools. It's providing the teachers with the skills so that they then can teach the children the skills.
What's the criteria you said where you need to bring someone that's interested?
Yes, and the training, actually, we're gonna open it up to all of the county, the rural schools in the county. But for right now, the 2 schools that have kind of expressed that they'd be interested in participating are created. But any school can participate. It's a 3-day training that's provided through, it's a program called DBT in schools.
Your staff won't deliver it.
No.
No, it's like you've got
It's a-
funding to train Kirk school personnel to
Exactly.
work with these kids, 12 to 19 years
So
old.
this is to accept a grant, right?
Exactly.
Yeah, I was just wondering what the criteria would be for schools who are interested in this to bring their name forward. I mean,
Yeah.
do they have students that would qualify or just?
It's going to be taught, the whole idea of the program is to be taught like throughout the whole school curriculum, kind of incorporated into like a health class. So all the young people in the school are receive the curriculum. And so we have we have a lot of what's called a system of care. And so we're in touch with all the rural schools, and we'll be reaching out to all of the rural schools, and anybody who wants to participate in the training will be able to.
It's just, it's like, I don't mean to pick.
No, that's okay.
Is just like, just a sample test with schools? I know it's open to all, but
It'll be
these
open
two
to all, and
schools
if
were
there are,
interested in proceeding with the training. Well, yeah, no, we're not, yeah.
So it's just those 2 schools have already expressed interest, but you're trying to get the other schools on
Yes.
board.
yeah, they're 2 schools that have been really active in our system of care, and anytime we've done a grant, or we've been able to, in the past, we've been able to secure grants and provide training for them. They've already participated in some past initiatives that we've had to teach DBT skills in the schools, so. But we will open it up to everybody in the county, and it'll be up to the particular school districts to decide whether or not they want to participate.
Is this a match-based grant?
Nope, it's just, it's just 100% funded.
Second question. This is only available to rural schools, not.
We're gonna open it up to all schools, including Auburn, if they want to participate, but it is a commitment. I mean, the teachers, it's a 3-day training, so there is a commitment of faculty time, so.
So excuse me for my questioning, the rationale in starting rural, what would that?
Well, it's a rural juvenile justice grant.
Is there more funds available? You see, opening up to other schools, which is great. Are there more funds
Well,
available?
the training will, the money that we'll get for the training, we can open it up to probably, I think it's about 50 participants, so that would more than cover all the schools in the county. So.
Great, thank you.
Here in the same schools, they already have gotten this.
At the high school, doesn't the high school do DBT?
Well, in the past, they've done DBT skilled groups that we've co-facilitated, and we provided money in the past for them to receive that training. But this is kind of more of a universal approach for all young people, not just young people who are targeted as being mental health problems.
Okay, we got a motion and a second. All in favor? Aye. Any opposed?
Lydia, abstain.
HH8, Liz, you're trying to just amend the current mental health budget we have, where you're putting state aid, because you've got additional state aid
Yes.
that you
Because there's
didn't
been a bump up,
anticipate.
yes, there's been a bump up in the state budget, as probably all are aware, so mental health funding has increased. As a result, our state aid funding has increased, and that state aid then goes to contract agencies. So this is just basically giving us permission to give the contract agencies more money, but it's not the county's money, it's state money that comes to us and then goes to the contract agencies.
In the resolution, you identify the agencies that it's going to.
Yes.
How much? Okay. Motion for HH8.
Second.
Mark, second.
All in favor? All right, great, thank you. And last but not least, HH10 is the kind of second part of what was passed last month. This is the Crisis Intervention Care Manager, a new CSEA position, grade 16, that you will be using to team up with the therapist so you can start the mobile crisis and county supported.
That's exactly right. So this is a model that's used throughout the state. A licensed practitioner along with a care manager will be responding to crises. And there are certain roles that the licensed practitioner can do. And there's certain roles that the care manager plays in this. So it's a team approach. Both of those positions will be able to bill for both of those positions within the it's a waiver that Medicaid provides to the state. So eventually we'll be able to bill for services, and we expect that in the future will be self-sustaining.
Okay. Got a motion second?
Mark, I'll move it.
Second.
So,
Okay, okay. All in favor? This sort of just completes the ARPA commitment that we just made for the startup of this program. Great. All in favor then?
Aye.
Great.
Did you want to address the opioid settlement? Is that something?
I'll do that.
Okay.
Yeah.
So,
Do you want to say anything?
oh, I just wanted to remind everybody, and I guess it's in your Dropbox, whatever that is. But yeah, it is mental health awareness or mental health appreciation month, and we had a really nice event on Friday. A noontime walkout, and Lauren Walsh was the keynote speaker. Teresa was a big part in.
Teresa, how many? She's the president of the CSB or chair of the CSB.
She participated in the mental health task force that really was responsible for creating all the events this month. There's going to be a panel discussion, kind of a mental health appreciation night at the Y, and it's going to focus on youth mental health. And there's also going to be a mental health appreciation proclamation at the county legislature. Just the medication assisted treatment, I know that Lauren is working really closely with the sheriff and some of our other community partners. As you all know, by October, the jail is going to be required to provide medication assisted treatment, including methadone and Suboxone. So that's a project that they're working on doing. Just one other thing about parking at mental health, because our staff bring this up almost daily. Parking is a problem, and it's going to be even a bigger problem once construction starts in the hospital parking lot. So we just hopefully there'll be some solutions. It particularly affects our clients who often are late for appointments because they can't find parking, or have even had to kind of just return home, not come to appointments because they can't find parking. So we're just hoping that there's going to be a solution for that. The construction for the hospital lot's supposed to start in June. So it's going to be a problem sooner than later.
Yeah, we had a conversation about it.
Excellent.
Thank you. Okay, last is on the agenda is called Ledge 2, whether it'll stay Ledge 2 or not. I don't know. Government obviously had a couple ledge resolutions. But this really is on the agenda tonight for information really only, because this will be coming to the floor on the 24th. And this obviously is asking if the county would have majority support to commit the opioid settlement funds to treatment, recovery, prevention of opioid use disorder and any co-occurring substance use disorder or mental health conditions. And basically, Rich has some of the information in terms of the funds. We are going to be front-loaded, it appears, in the first 5 years, getting a decent amount of money, and then some of these settlements go over 18 years. So, year after year, after the front-loading of the funds, they may be smaller amounts, but they will continue on for a while. And there are My understanding, there are direct funds that must, you'll see in the whereas, direct funds must be used for certain approved uses such as prevention, treatment, occurring substance use disorder, mental health conditions, public education, and all of the criteria that are involved in these direct restricted funds. And then there is a portion of this opioid settlement money that's called direct unrestricted funds. And that, I guess, could be used by the county for any appropriate governmental purpose. But if this resolution passes and gets support, this is asking for consideration to commit both the restricted and the unrestricted funds and reinvest it in preventive services or treatment services within the community. We certainly know we have unmet needs. And this resolution, if it passes, also will authorize the Cayuga County Community Services Board as the agency responsible for developing and overseeing the provision of substance use prevention and treatment programs throughout the county. And they would be the agency that would identify based on specific needs and make recommendations to the Cayuga County Legislature. There's a subcommittee on substance use disorder that reports to the Community Services Board. This really is the entity that I think makes the most sense for organizations, because there's been a lot of conversation already from various organizations looking for some of this money to support or some of the current work they're doing or to develop additional or new programming. And we need a process to be able to figure all this out. So this will leverage the funds, and then this will have the Community Services Board be the entity that reviews these proposals and comes with recommendations for spending. Rich, you had told me there was probably the first few years close to $600,000.
So we're getting, according to the Attorney General's office, the county should receive upwards of $500,000. 60% of that, so a little over 200,000, is restricted, and then the other 40%, 200,000 plus, is unrestricted. But as Elaine said, it is front loaded, so we're getting like each of the settlements are negotiated with separate drug companies, so they come in different. We have one settlement with Johnson & Johnson that's over a 10-year period with 2 years paid the first year. We have another settlement with what they call the distributors, which is a group of companies who were involved in the distribution, including some retail pharmacies, that kind of thing. Those monies are spread out over 18 years. Again, so we're getting a big chunk in 2022, and we will have continuing payments, but they will be at a much reduced rate. 10. So that's going to be.
And you know, before the sentiment was before the Community Services Board or the organizations are asking where do they go, we wanted to see if we had agreement from the legislature to use these funds for this purpose and support the Community Services Board role in reviewing them and making recommendations. And that's what this resolution will do.
I want to congratulate you for writing this up. I think it's perfect. I think the board is the one that should decide where it's going. I'm 100% behind this. I'm good. Thank you.
And thank Rich for
Thanks, Rich.
writing it. Okay.
I just have a quick question on it. So, would Heal then have to go to like that board if they wanted to use those funds for their program?
Yeah.
Okay.
And I'm sorry. And we talked about too, you know, once the funding is allocated, the Community Services Board will look at performance quarterly, how are things progressing and that kind of work as well. But yes, that would be instead of calling Dave or calling you or I mean, this is the process that we're hoping to put into place.
Is this going to, so the jail issue, right, with having to make sure that we're providing the right insurance. Is that part of this?
My understanding is the jail got, the mental health got $100,000 that we ended up passing a while ago to help with the implementation of the Medicaid for opioid use disorder that's required for them to do in October. And that 100,000 is really going to help pay for the medications, and you guys are going to work on the programming with the sheriff. So he may not need any of this particular money. I know there's been discussion with Chad, Nick's Ride, now Heal. I mean, there are organizations who are wondering how they would write a proposal and get access into these reinvestment dollars. And same thing with Healing Community Study and coordination. If there was a ask for this money, it would come through the community services board.
We have actually eight agencies that we have on this.
Yeah.
This is what the opioid money should be. Absolutely.
I just want to reinforce that message, that this is a very forward-thinking resolution in that we're identifying right up front that 40% that can go into direct, unrestricted, could easily have ended up in our general. It's great that I completely agree that we're saying, well, yeah, for the next 20 years, we're not doing that. This is investing for the entire community that's going back to society.
So what I'll do after this again is for information only, it'll be voted on at the meeting. I'll have Amanda, or I'll send it out to every one of the legislators prior to the meeting, and it's unclear, it's unclear whether it'll be on the ledge, or I'll introduce it, but we're still trying to figure that out, right? Okay, great, all right. Kathleen?
I just want to thank everybody for coming here to play space in our WIC office. To really, we want to showcase our WIC offices, and so thank you, Tanya, for doing that. Tanya stayed here to be able to provide some tours to anyone here who didn't have that opportunity prior to the meeting. And Nancy Tian stayed at Play Space to be able to give the tours also. So,
All right, thanks for hosting us.
Thank you very much.
All right, can I get a motion to adjourn?
Motion, Lydia.
Okay. All in favor?
Marco, second.
Yeah.
Bob.